Now, as you know, the history of the Indian pharmaceutical industry is a fairly long one. Probably not as long as it's been in some other countries, but at least dating back to the 1970s. And the history of the Indian pharmaceutical industry is very much the history of generics. There have obviously been innovator companies in India for a very long time. I can think of Pfizer as an example. I'm not sure Novartis also has been in India for quite some time. But basically the history of the homegrown industry, if you like, is the history of the generic industry. Now, and that brings me to the question of all the recent changes that have been, well, not quite recent, but you know, the Patent Act was amended in 2005 and before that in 2002, and the first amendment happened in 1999. But insofar as this long history that I've been talking about is concerned, these are all still fairly recent changes, and their impact has not yet been fully felt or recognized. So I'll be partly talking about what that impact has been and what that impact is likely to be going forward for the generic pharmaceutical industry. Now, obviously you know that the most important change that was made when the Patent Act saw its final shape in 2005 was the recognition of a product patent for pharmaceuticals. So this opened up a whole host of possibilities that now you could get molecule patents as well as other forms of product patents in India. Now, this is of course not a change which is limited to India. This is a change which comes about because most countries signed up to the TRIPS agreement in 1995. So it has been a global change, but the change has come about in phases depending on which region of the world you're talking about. The experience in different countries after the introduction of these new laws has also been different. What has the impact been in India? Have we seen any impact of the 2005 amendments, more specifically the recognition of product patents on the generic pharmaceutical industry in this country? Well, I would say that in the interim 1995 to 2005, there probably wasn't any significant impact. And the reason for that is quite obvious. It's because TRIPS does not allow a country to recognize product patents that were known in the public domain before the TRIPS agreement itself came into force in 1995. So therefore, no product that was known to the art prior to 1995 could ever have been patented in India. And because the development life cycles of most pharmaceutical products is very long, the average time it takes for a molecule to reach conception to market is maybe about 10 to 15 years, and the cost is also enormous. So I would say that up to about 2005, you probably didn't see too many product patents being granted in India. But that has certainly not been the case over the last 7 or 8 years. We are increasingly seeing a number of product patents not only being granted but also being enforced by companies. Has this proved a deterrence to the generic pharmaceutical industry in India? Has it had any significant impact on their fortunes? Now, the fortunes of Indian generic pharma depend, of course, on the Indian market. It is a very large market for most of the companies, but their larger markets are abroad. So therefore, has this product patent regime or these product patents which are being granted, have they impacted their sales abroad? And the answer is surprisingly no. I do not see too many suits filed against companies who are manufacturing products in India, because the act of manufacturing itself is an act of infringement. You do, however, see a number of cases being filed against generics, where the generic company is intending to launch its finished dosage form in this market. But you don't see too many cases where, for example, the manufacture is taking place in India, but the sale is intended for markets abroad. And I'm not quite sure why that is, but perhaps there is some sort of a tacit understanding, if you like, on that point.
And change.
I don't want to put ideas into your head.
You did.
Now, now, of course, there are lots of safeguards have been provided in the Indian Patent Act itself. And, you know, obviously we've, a lot of these conferences and a lot of places, these have been, you know, extensively debated. Provisions like Section 3D, provisions like the method of use patents not being patentable, for example, compulsory licensing provisions. But are these provisions really so exceptional? Now, some of them probably are. But if you take, for example, compulsory licensing that one of the speakers before me was talking about. Now, compulsory licensing as a matter of patent law is nothing exceptional. Compulsory licenses, or the provision to actually grant compulsory licenses, exists in almost every country in the world. In fact, it may interest you to know that historically, the US has invoked more compulsory licenses than any other country in the world. But of course, the compulsory licenses there were probably in response to an antitrust kind of situation, more than they are to, you know, actually increase the availability of medicines like they are in India. The method of use patents, if you take another example. Now, the Indian Patent